Well, and I think you're pointing out the environmental damage because you're massively hurting the environment by allowing more mercury to be used in your body. Of course, you don't want it in your body, but you don't want it in the environment either. The fish don't create their own mercury. The fish we're eating with mercury, that came from amalgam or another mercury source. I'm very proud of the movement in California, the Californians for Green Dentistry Project. That is part of our campaign for mercury-free dentistry. Our organization runs this international campaign for mercury-free dentistry. And this Californians for Green Dentistry has persuaded a number of cities to start urging the end of amalgam. And leaders have stepped forward. Mayor Gary Monahan of the city of Costa Mesa, his city passed a resolution calling for the end of amalgam. Now they're moving forward to have disclosures on the amalgam. Mayor Miguel Pulido of the city of Santa Ana, a Democrat, Latino, and Gary Monahan's a Republican in an adjacent city, both parties. Mayor Pulido has issued a proclamation urging the end from his city, urging all dentists to stop using amalgam immediately in his city, and urging the end of amalgam worldwide. The movement in California is to ban amalgam. And let me add, Dr. Mercola, the Food and Drug Administration is headed to California, headed to San Francisco for a hearing. People that want to go can sign up until September 9th. On September 22 is that hearing. And if they can't come or they don't live anywhere near San Francisco, they should write FDA and say, when are you going to protect the children of America? When are you going to protect the pregnant women? And the email to write is Jeff Shuren, Jeff.Shuren, and his name is S-H-U-R-E-N, S-H-U-R-E-N, Jeff Shuren at fda.hhs.gov, G-O-V, and say, Dr. Shuren, you are in charge of this project. When are you going to listen to the scientists of FDA who themselves have said you need to end the use of amalgam?
Well, it's just an amazing effort you're making, and I think at this point I'd just like to mention your experience because you're an attorney, and you know, I personally think that this country has far too many attorneys, but we certainly need them because you know the part of the process of the battle is to work the system, and I'm wondering if you could share with our viewers your specific experience and you know specifically your serving as a state attorney general and then your transition into this movement.
Well, sure. I was state attorney general of West Virginia. It was a great experience. That was the politics part of my life in my 30s. I became a general lawyer for a number of years, and then in the about a dozen years ago, I had the great opportunity to join Jim Turner's law firm and work on alternative health issues. From that came the organization Consumers for Dental Choice. We then started the campaign for mercury-free dentistry. In the process, I was representing dentists all over the United States. Dentists who were being told, you will lose your license if you tell the truth about mercury. Keep the silence. Don't use the M word. And we went into the dental boards, into the courts of America and said, hey, wait a minute, judge or administrator. Dentists have a right under the United States Constitution to talk to their patients, to advertise. They can tell the truth. They can say the M word. We won. We won in state after state, court after court, or in dental board after dental board. In fact, the legislature of California shut down the Dental Board of California. They said, you are so bad, we're abolishing you and starting over because you won't let dentists talk about mercury. I mean, we got that much success. The American Dental Association, because it had patents on amalgam, did a gag rule and said, you can't talk. We will get the dental boards to pull your licenses. That's how severe it was in the 1990s. Only 3% of dentists were mercury-free. Nobody knew about the mercury. Now, more and more people know, but most people don't know that amalgam is mainly mercury. But the battle was first over the rights of the dentists who were mercury-free to stay mercury-free, and the rights of more dentists to convert to mercury-free dentistry. Half the dentists have done it. The question is, why haven't the other half? Why are they still practicing pre-Civil War dentistry? Amalgam is a primitive, polluting, pre-Civil War product. It has no business in the 20th century dentistry, and for goodness sakes, we're in the 21st century now. So I call on the dentists of America to wake up, but if they won't wake up, if they insist on continuing to put mercury into children's mouths, please don't give that dentist any money. don't go to that dentist anymore. If he says, I won't put amalgam in your mouth, but he puts it into the mouth of the child on Medicaid, that dentist is no good. Go to a dentist who's mercury-free, because there are mercury-free dentists in your community.
Very good point. And as you mentioned earlier, about 50% of the dentists are mercury-free?
Yes.
Okay, so that's half.
Yes.
I mean, most likely is going to be one. And that's one of the ways that we can vote with our pocketbook and have
Yes.
enormous economic influence. And not only economic, but influence environmentally to motivate those remaining 50% to make their final choice and decision to remove mercury from the office. Because even by having them not put in mercury in your own mouth or your family's, you're still endorsing him and supporting him by going to that dentist.
He's hurting the patients, and he's hurting the workers. For the women that work in dental offices, it is a perilous occupation. Their reproductive systems are damaged in a major way. That is provable in study after study. The reproductive failures, the fecundity rate is less, the ability to get pregnant, the terrible. We've had one of our big advocates took her own life, who was a dental worker. Mercury drives people crazy. That's why we had the Mad Hatter disease. The Mad Hatters used mercury to make hats. So let's recognize how horrible mercury. Many dentists, the highest suicide rate of any profession, according to studies a few years ago, is dentistry. Because, again, they themselves are so toxic and full of mercury. So we are trying to reach out to dentists too. This is good for the dentists to stop using mercury. The only losers will be the amalgam industry and the big bucks that the American Dental Association takes from them to continue to advocate for mercury fillings.
So you mentioned also that the majority of people don't yet understand that silver fillings are mercury.
They don't, according to our polling.
What would your poll suggest? Is it maybe?
The Zogby poll says 3/4, 78% could not identify.
75%, even though
Right.
50% of the dentists don't use it, still 75% of the general population are not aware of
What's
this.
the main component of amalgam? They either got it wrong or they didn't know. Of course, silver would have been the first choice. We didn't say, what's the main component of silver fillings? It wasn't
Sure.
that lead of a question. That would have been, we'd have got 99%. Who's buried in Grant's tomb, right?
Yeah.
So yes.
With that last question, I'm sure you have a large number of people who would not know the answer to that.
Okay, Tomb. That's who's buried there, Mr. Tomb. Anyway, but I think the momentum is really building, and we ask for your support. We ask for your financial support for the campaign for mercury-free dentistry. We ask for your support in writing the Food and Drug Administration or your own agency if you're Canadian, Australian, British, African listening. Joe Mercola's reach is worldwide, and it's so exciting to be on your program, Joe, and to be able to give a pitch to people everywhere. I was in local politics when I was on television. Maybe a few hundred people would watch, but here we're on talking to people worldwide, and our message is important. 1 billion people have been affected in some way because they have mercury in their mouths. And Hal Huggins told me you can help 1 billion people by digging into this cause. I'm very honored to be the president of the World Alliance for Mercury-Free Dentistry and to lead these delegations to the United Nations. But we need to have a team. Our team includes people from developing countries that don't have the same resources as we have in this country. We want to get our whole team there. We have vice presidents from all continents and regions. And we have a movement that I think in the United States and worldwide can win if we just keep our shoulders to the wheel.
Well, thank you for all your efforts. There's no question you're a real major catalyst to make sure that we can start the process of eliminating mercury. And you've already made great progress in the 15 years your organization has been around, just in allowing dentists the freedom to tell the truth that there's mercury in the fillings. And now, as an extension of that, in which you were a major part, or played a major role, that 50% of the dentists now don't even use mercury in their practice. That's major progress. So it's not like we're spinning our wheels here. We're clearly making progress. I mean, this is a brain dead, easy, an obvious problem. I mean, mercury is a toxic poison. It shouldn't be in our mouth. It's not like it's the only alternative. We have simple, inexpensive, relatively inexpensive, non-toxic solutions that are rapidly being adopted by developing countries and clearly need to be used more here. So, you know, as you mentioned, I mean, if your economic resources allow you to do that, and you feel strongly as we do about this, and supporting Charlie's project would be a great thing. If you can't do that for whatever reason, you know, the economy is a struggle for many people, then you can clearly vote with your pocketbook and not see a dentist who is using mercury in their practice. And you can easily find that out by calling up their office, you know, not even identifying yourself maybe as a new patient, and then asking if they have used mercury in their office. And if they do, then it's time to see a new dentist, because that dentist doesn't understand the basics, and there's just no reason that they could ever justify using mercury or continue using mercury when there's just no justification for that decision. So there's no reason for you to support him or her. So I would strongly recommend that you apply these and really help the cause of saving our world for our descendants, because if we continue this, we're going to continue to dump mercury into the environment. So are there any other comments you'd like to make to give people with respect to informing them about this?
Joe, our Native Americans talk about what are we doing for the 7th generation, and getting mercury out of the environment means in the 7th generation we will have only the natural occurring mercury, but we can really have much more healthy people, more healthy each generation, and we're not just benefiting ourselves or even just our children. Mm-hmm. We are reaching, whether we have children or not, we are reaching down to the 7th generation of mankind. And let's start thinking about that when we make decisions. I guess when you reach my age, you have to start thinking that way, and I'm trying to do that, because this is a campaign that can win, the campaign for mercury-free dentistry. It can win in the United States, it can win worldwide, and we have such an outstanding team of people working on it. It's time for our government to listen. The Food and Drug Administration has not gotten the message, but with your help, it will.
Yes, well, thank you for all you do and being such a tireless advocate for this important movement, and we really